Well, hello. Welcome to the Advanced Pharmacology course. We will be going over the objectives briefly here for each week. Week one, we will be just getting together in the live session and reviewing some of the state governing boards, practices, and laws and rules concerning practice in the state that you reside in, and the overall key role of the nurse practitioner in terms of prescribing medications. Class 2 will be looking at pharmacodynamics, identifying basic pharmacodynamic principles when prescribing medications. We'll define some terms related to pharmacodynamics and identify important ligand receptor binding properties. Class 3, we're going to look at pharmacokinetics and the principles associated with pharmacokinetic activity of drugs and the influence of pharmacokinetics in relation to absorption, distribution, biotransformation, and elimination or excretion of drugs or parent drugs or metabolites. Then our class 4 will be exam 1, which we'll do in the live session. Class 5 we'll be looking at prescribing in specific populations, starting with the older adult, and we'll be talking about and learning about aging changes, pharmacodynamic and pharmacokinetic properties in an aging population or adult population, adverse drug events, antibiotic treatment, treatment of diseases such as gout, thyroid, bowel and bladder disorders, and controversies completing over aspirin. And we'll be talking about some physiologic changes, iatrogenic complications, and potential pitfalls that we face in prescribing practices for the older adult. And then in class 6 we'll be talking about populations, pediatric pregnancy and lactation. We will define practices prescribing in childhood and looking at differences in physiology between a child and older person. And we'll be also looking at taking care of pregnancy and lactation. Week 7, antibiotic therapy in adults. A little fly. And then we'll do class 8, we'll be covering antibiotic therapy in children. Then week 9 we'll have a second exam. Then week 10 we'll look at gastrointestinal disorders and talking about the GI system and specific GI disorders, from simple nausea to Crohn's disease and ulcerative colitis and everything in between. Class 11 will look at contraception and review the physiology of the reproductive cycle and different methods of hormonal contraception. In class 12, or week 12, we'll look at hypertension, look at some of the JNC7 and new JNC8 guidelines for that, and the classes associated with treating hypertension, from beta blockers, ACE inhibitors, to ARBs, diuretics, alpha blockers. In class 13, we'll look at hyperlipidemia and look at the ATP3 guidelines for treating elevated cholesterol and treating children as well. And then, of course, week 14 we'll have our final exam and course evaluation. And in the course room foyer, I have placed my contact information. Please contact me if you need to.